Hey guys, this is Dr. Karan here from DrPKLyfe again. So Friday, it was a busy Friday. At the end of the day, I decided to put this video because I saw a bunch of patients and that inspired me to talk about it. This is about chronic alcohol use and how it affects your body, chronic alcohol poisoning, and what's doing to your body and mind. I see that often here. You don't have to pass out from alcohol to be poisoned by it. I mean, chronic alcohol poisoning is happening slowly, sip by sip, day after day. It can really destroy your body and mind before you can realize it. So I want to bring this to your attention so that you're aware that it does damage a lot more than you are aware of. Chronic alcohol, because chronic alcohol poisoning is happening because people are getting used to drinking at infrequent basis, and they require more and more every few months. So it starts with one drink a day, then they have 2 drinks a day, and then down the road 3-4 drinks a day, and then you start developing tolerance, and so you want more or different kind, maybe have more concentrated one. Everybody's aware that when you drink that your liver has to work hard to break it down, to break down the ethanol into acetaldehyde. And acetaldehyde is a toxic chemical that damages cells and DNA. And if you drink often, your body never fully recovers between exposure. Chronic alcohol can cause fatty liver, alcoholic hepatitis, which is inflammation of liver cells, and causes cirrhosis, which is permanent scarring that stops your liver from working. This means toxin builds up in your blood. Alcohol kills brain cells, shrinks brain volume, and changes memory centers. Long-term drinkers can develop Wernicke's-Korsakoff psychosis, severe memory loss, and confusion from vitamin B1 deficiency. And alcohol raises blood pressure and weakens your heart muscle, increases the risk of arrhythmia and atrial fibrillation. Alcoholic cardiomyopathy is a very well-known disease just because of chronic exposure to alcohol. Gut and cancer risk. It irritates your stomach, causes ulcer, increases the risk of cancer. It's a directly linked to cancer causation from mouth, throat, liver, esophagus, colon, and breast. There's no doubt about it. So be aware that alcohol is very dangerous. Alcohol dependency rewires your brain reward system. So over time, you feel less pleasure from normal life, things which makes people happy. You get more depressed and you are anxious and irritable without alcohol, because that's the only thing that gives you happiness. The cycle of dependency, you develop tolerance, you drink more for the same effect, then you have withdrawal symptoms, tremor, sweating, insomnia, seizure, and that pushes you back to drinking again. So it's really, really important that if you find that this video can be helpful to people you love who are having difficulty with alcohol, pass it on to them. So in chronic alcohol use, ethanol, which is alcohol, converts into acetaldehyde, and that converts into acetate, and you have continuous exposure to acetate, liver, whole body, liver, brain, other organs, heart, and then the risk of fatty liver, alcoholic hepatitis, cirrhosis, liver failure, liver cancer, and other cancer of gut, mouth, throat, esophagus, stomach, colon, and breast cancer. Alcoholic cardiomyopathy is a known very well-known diagnosis, and it weakens your heart muscles. People have high blood pressure issue and high risk of stroke and arrhythmia like atrial fibrillation. The possibility of gastritis and gastric ulcer, pancreatitis, which causes inflammation of pancreas, is severe pain. Sometimes patients have to be admitted in the hospital for days. And there's as I said, a risk of cancer of mouth, esophagus, liver, colon, and breast. It lowers the testosterone in men, and so men lose interest in sex, and their libido is gone. Same thing happens with a woman. It weakens the immune system, and you end up having more infection, more depression, anxiety, more emotional instability and irritability. You have loss of interest in non-alcohol rewards. Their sleep is disrupted. You're tired and you're irritable all the time. So you have tolerance, more drinking, withdrawal, shakes, sweating, seizures, and there's psychological dependence. You feel unable to cope without alcohol. So early detection, you got to get liver testing done, counseling, medical detox, AA meeting, support group, smart recovery, nutritional rehab, restorative vitamins. Those things are really, really important. So chronic alcohol poisoning is slow burn, but you can stop it. Protect your liver, protect your brain, protect your life, and pass on this information to other folks who are looking for help. This is Dr. Karan. Have a great weekend.